But yeah, so thank you everyone for coming. Especially I know it's Friday and right after school, everyone probably had plans. So thank you for being here. I see some new faces, but yeah, thank you for attending, and especially thank you to you, Dr. Carlo, for joining us and helping us raise awareness. So yeah, um, just take it away.
Thanks, Jason. I appreciate it. Thanks everybody for attending. Really appreciate Jason's mission. The organization sounds like a really great organization, so I'm happy to help. So what we'll do is we'll go over a couple of we'll go over the ACL. I know Jason and I have been emailing each other. There's a lot of questions about that, so we're going to go through the presentation. And then if anybody has any questions or anything like that, feel free to just message me or kind of put something in the chat, and we'll go from there. All right, let me see. I'm going to go ahead and share my screen. Let's see. I think you have to enable me to share my screen, Jason.
Just did. Can you?
There we go.
Yeah.
All right. Can you guys see that okay? Excellent.
Yep.
All right,
Perfect.
guys. All right. So today we're going to go over one of my knee workshop series, specifically talking about ACL injuries. We'll kind of go through this little by little, and then, like I said, if you guys have any questions, feel free to let me know. Okay. So again, welcome to today's presentation. My name is Dr. Carlo Sayo. I'm a physical therapist and owner of Empower PT and Wellness here in Chino Hills, California. I've been doing this for about 15 years now. Graduated from USC with my doctorate. I specialize in injuries and other orthopedic issues, neck pain, back pain, those sort of things. Happy to talk about that more later if you guys have more specific questions about that or physical therapy in general. All right, so, okay, our mission in Empower Physical Therapy and Wellness is to help people make better decisions about their health. It's one of the reasons why I love doing presentations, workshops. Back before COVID, I had a lot of those at the clinic, but it's ultimately to help the community make better decisions about their health and how to prevent injuries. Okay, we specialize in helping active adults get out of pain so they can get back to doing the things that they love to do. All right, guys, so today's agenda, we're going to go over introduction to the knee, go over the anatomy of the knee, talk about what exactly is an ACL, what happens with an ACL tear, how do ACL injuries occur, how to prevent these kind of injuries from happening. And one of the biggest mistakes people make when they're trying to avoid having this kind of season-ending injury. And at the end, I also want to talk a little bit about what you guys can do to avoid these kind of sports injuries, not only for yourself, but for your teammates or any kind of loved one. I want to make sure you guys know what kind of options you guys have to prevent those kind of injuries. Okay. All right. Any questions so far, guys? You guys with me? Okay, cool. All right, so we're gonna start off with the knee. We're talking about the bones, the muscles, tendons, ligaments, and then end with talking a little bit about the meniscus. All right, so we'll start talking about the bones first. I'm a little old school here, guys, so I'm gonna go over the PowerPoint. But I was able to grab one of these knee models from the clinic. So I'm going to go over a little bit of that. I'm a visual guy. So can you guys see my screen okay? So I'll go over the PowerPoint presentation, but also kind of go use the model so you guys can get a visualization of it. Let's talk about the bones first of the leg or the knee specifically. So if you guys can see my cursor, we have the femur. We have the tibia and then the fibula. So I'm going to look at this guy right here. So you have this, in this particular case, would be my right knee. You have the femur right here, which is that thigh bone. And then you have the tibia and then the fibula, which is on the outside of that lower leg. If I turn the knee to the side, then you have what's called the patella, or commonly known as the kneecap. Okay, so that's kind of the bone. So we're going to start off with that. Okay. All right. From there, we go into the next level, which is the muscles. I won't go through all the muscles. I'll go over some of the general muscle groups, which you guys probably are familiar with some of them. But more importantly, I might refer back to that when I talk about how these kind of injuries actually occur. But on the left side of the screen is the front view of the knee. So you have the big one here called the quadriceps, right? And that's the muscle right on top of that femur. That's if basically your thigh, the front of your thigh, okay? And then on the back of it, you have the hamstring muscle. So if I turn the leg around, the back of the leg or the thigh, those consist of what's called the hamstring muscles. Okay, so the quadriceps extend the knee, the hamstrings bend the knee back. Okay. And then you also have your calf right here, and it's not shown on here, but also if I put the hip down, this is my hip bone right here, right? And you have those glute muscles right here too. So you guys might be familiar with those glute muscles as well. It's around your hip and your pelvis. Okay. All right, so let's talk a little bit about ligaments. So there's essentially 4 major ligaments to the knee. So again, I'm going to refer to my model here. So if you guys look down at your right knee, let's start off with first the outside and the inside of that knee. Outside is lateral, inside is medial. And if you guys follow sports, you guys might have already heard some of these terms before when an athlete tears an MCL, LCL, ACL, those kind of things. So my hope is at the end of the day, you guys get a little bit of an idea how those ligaments work. So if you're looking at the knee, your right knee in particular, right? I'm going to grab a pen here. Okay. So I'm going to take my pen, and this is my right knee. I'm going to put my pen right on the outside of the knee. One part touching the femur, the other part touching the tibia and the fibula right here. So that's on the outside or the lateral part of the knee. That's called the LCL. It's a lateral collateral ligament. So if you see how it's on the knee, it's going to help actually prevent this kind of, I'm going to take them off for a second, kind of this kind of bending. So it's a thick ligament that prevents any bending excessively of the knee going sideways. You guys with me so far? Okay.
Yeah, sorry to interrupt. I think there are like some people in the waiting room. I made you host, so I cannot accept them.
Okay. All right. I saw something pop up. Let me.
But if you can just accept them real quick.
Wait, I got you. Thanks for letting me know, Jason.
Yeah,
I saw that
sorry
pop
about
up.
that.
I wasn't sure.
Yeah.
Are we okay? Just let me know if I need to do that. Should I go back a little bit more?
No, I think we're good to move on.
Okay, sounds good. It's probably a good place to kind of jump in anyway. Hey guys, sorry I didn't let you guys in. I wasn't sure. I didn't know I was like in charge of that for a second. All right, so we're talking a little bit about the ligaments right now. So again, looking at the right knee, you have the LCL. That's a lateral part of the outside of that right knee. So if you look at my pen, this is my right knee. It holds the outside part of the knee together. So if it bends a certain way, the idea is it stabilizes the knee so it doesn't like bend that way, right? Then you have the MCL, which is the inside of the knee. That's the medial side of the ligament. Again, the idea is to prevent any kind of bending that way of the knee, okay? Now, this is where it gets a little bit tricky. So the ACL, I'm gonna flip the knee sideways like this. So now I'm facing this way towards my right. So I'm gonna take my pen, I'm gonna go slightly diagonal, guys. Can you see that? So the top of my pen is attached to my femur. The bottom of my pen is attached to my tibia. So the idea is it's supposed to prevent that knee from shifting forward. So it's called anterior cruciate ligament. So it goes from back to front, basically. Okay. Now the PCL then is kind of the opposite of that, basically. So you take my pen, I'm going to flip it around this way. So the top of it attached to the front of the femur, and then the bottom of it attached to the back of the tibia. So again, that prevents the knee from shifting backwards. So the body's kind of cool because it makes these kind of structures almost redundantly to try to create more stability for the knee, not just with muscles, not just with bones, but with these actual ligaments that surround that knee. So you guys got an idea so far? I got the outside of the knee, the LCL, the inside, the MCL, and then the ACL and PCL, which is more inside the knee. Okay. Any questions about that? We good? Okay, I'll just keep going. All right. So what happens when you tear an ACL? You guys basketball fans here? Sort of, maybe. There you go. So yeah, I mean, I don't want to pull up like this gross picture of somebody tearing the ACL. I kind of picked something a little bit more tame. So unfortunately, this is Klay Thompson. He tore his ACL at the end of the finals, not last year, but the year before. Again, it's a pretty common injury, unfortunately, with a lot of these type of sports. Okay, so let's say you're in a situation where, well, what are the signs and symptoms of a torn ACL? Typically, there's a loud pop or popping sensation of the knee. There's severe pain and inability to actually get through your activity. There's a ton of swelling that happens right afterwards. A loss of mobility or range of motion also occurs. And then the feeling that you can't really hold your weight up, like the knee is giving way. As you can imagine, it's a pretty important ligament. So, and then on top of that, there's all that swelling and pain. It really makes it hard for you to hold yourself up when that kind of injury occurs. Okay. By any chance, anybody here, you guys don't have to, you can put in chat or whatever. Anybody here hurt or tear the ACL at all, or know somebody that tore their ACL? I'm gonna
I
assume no.
tore mine, but I had a knee dislocation. Oh,
Yeah.
Zach had one. I didn't know that.
Okay. There you go.
Wait, so ACL is preventing it from going too forward, right?
Correct.
Oh, I
Correct.
see. I see.
Yeah. So it's I'm glad you pointed it out, Jason. I mean, I don't want to, there's some nuances too, where if you look a little bit more from the front of the knee, it actually also prevents it. It's not just front and the back. If I'm looking in the front of my knee like this, the ACL just does prevent it from going forward. But look at my pen, it's kind of slightly going this way too. So that's why a lot of injuries, when somebody hits, I'm going to go over that later. When somebody goes in that way, that's where they tear the ACL, right? Because it's also responsible for a little bit of that inside and out type of stability, not just the front and back. But great point. That's the major angle that the ACL stabilizes more going forward. Okay. All right. So okay. So again, some of the more common ways that this injury happens, there's a cutting injury, you're slowing down, you're changing direction, you pivot on a firmly planted foot, you land funny on a jump, you stop suddenly, or unfortunately, sometimes, not much you can do. Somebody just hits you on the side of the knee, maybe a football injury, soccer, or any other kind of contact sport. Unfortunately, that can happen. Okay. All right. So how do we prevent these kind of injuries? Before I kind of get into that, I want to talk a little bit about how, like, kind of the big picture, what ultimately happens, barring somebody knocking you on the side of the knee, let's say land funny or just kind of do a cut. What happens when you tear that ACL, right? I'm going to again use this as a visual, guys, and then this way when I talk about how to prevent it, it makes more sense why specialists and experts recommend doing these kind of things to prevent that kind of injury. Is that cool? Okay. So again, I wish I could zoom back, but this is the leg, right? So again, like I was talking to Jason about earlier, let's say you plant your leg or twist or pivot. Ultimately, this is what happens, right? You get knock-kneed, your femur goes one way, your foot stays the other, and there's this torque that happens in the knee where it goes this way. Not only do you tear your ACL, right, but you could tear let's put it this way, because I'm glad Jason brought this up. You said you dislocated your knee, Jason. Imagine you plant your foot and then the knee goes this way. There is literally a dozen type of injuries that can happen from this kind of position, right? The ACL can dislocate your kneecap, right, which is kind of a dislocated knee. You can tear your MCL and then your meniscus and other structures, just because it's not supposed to go this way. It's supposed to stay straight, right? So if you look at that actual position, that's ultimately what we want to try to avoid, is that like that knee buckling or caving in, getting knock-kneed, so to speak. You understand me when I say that? All right, so to prevent that, most experts talk about strengthening the leg muscle, especially with emphasis on hamstrings and the quadriceps too. A quick word on the hamstrings. Again, that's the muscle behind the leg here, right? So if you follow along with what the ACL does, it prevents the ACL from the knee, excuse me, the tibia from going forward, right? So the hamstrings, in theory, mechanically, not in theory, but mechanically, that muscle supports the back of the tibia. If it's strong enough, it'll hold it back so it doesn't shift forward. So when it comes down to it, you want, even though you want strong quads, which are still thigh muscles, the hamstrings are pretty important too, because it does help support that ACL. Okay. All right. The next one, a lot of the newer science and experts and research is supporting more of this, which is strengthening your core muscles, right? Your glutes, your pelvis, and your lower abs. I think if you follow any kind of sport and or sports science, you kind of see a lot of these athletes working on their core. There's a good reason for that, especially with knee injuries. Going back to the injury, right? If you're kind of planting and your knee buckles, one school of thought is, well, you got to have your knee, your thigh, your hamstrings, your quads all strong. But what you actually have to do is you look up the chain, so to speak. When your knee buckles or you get knock-kneed, what actually controls that inward motion is your glutes and your core. I can cite a bunch of research, but I mean, one of the research studies went over a treatment protocol that just worked on core strengthening, not knee strengthening, and they had really good results. So the bottom line is you strengthen these hip muscles, that really helps support that knee long term. And quite frankly, even on a clinical level, I get a lot of athletes that have huge quads, huge hamstrings, but if you test their glutes and their core, not that good. And that's where their injuries occur. So yeah, definitely want to have a treatment program or an exercise program that incorporates core strengthening, glute strengthening, and coordination. Questions about that so far, guys? Cool.
No question, but sorry to interrupt again. Can you make me co-host? Because I think we have
Yeah.
more people at waiting room.
Yes. I'm sorry. Let me see if I can help you with that. I apologize. How do I
But
how
I
do I
think
do?
you click to the participants and you click more.
Okay, I'll let that guy in. And then I'll do, you said more. Okay, perfect.
Mm-hmm.
And then should I do something here, Jason?
You can make me host if it says.
Okay, got it.
Okay.
Okay, am I gonna lose my PowerPoint then if I do that or no?
I don't think so.
Okay,
I can make you co-host again, but
let's try that.
yep.
Okay. Okay,
Thank you.
cool. You're welcome. Thank you. Okay. All right. So on that note, okay, so a treatment program or training program that incorporates or has an emphasis on coordination and control with jumping and landing is absolutely crucial, right? Because you got to be really specific with the kind of sport and activities you're trying to do. So again, imagine if you land or jump or pivot, you want to make sure that when you land, it's pretty stable. You want to prevent this kind of angle from happening. So really being specific with that is crucial. And which is similar to point number 4, which is again with cutting and pivoting, you want to make sure to train specifically how to optimize those movements, minimize any deficits, I call it, so that when you're out in the field, out in the court, less likely to hurt yourself. All that has to be, checked off, and in my opinion, really focus on your specific sport. Okay. Okay. I want to take a minute to talk about the number one mistake I see here at the clinic when it comes to these kind of season-ending injuries, which is ignoring pain. I have a lot of athletes here who, if let's talk about the people who actually tore their ACL or tore their meniscus or tore their MCL, and most of the time, by the time I've seen them at the clinic after surgery or having this kind of injury, a lot of times they already have some sort of, they tell me that at some point, maybe 6 months ago, a month ago, a year ago, they had already some sort of injury or some sort of pain in that knee that they pretty much ignored or tried to sweep under the rug. They gave it time to rest. They used some medications to hold it off. But a lot of people will tell me, a lot of my athletes will say, I always knew after that first injury, after I had a little bit of pain with those 2 days, that I really wasn't 100%. And then fast forward to unfortunately, the season-ending injury, not so good. So still good prognosis with people who do, have surgery, but a lot of times that's the biggest mistake people make, is that they tend to ignore those kind of signs. They either not tell their parent, they don't tell their coach, they don't know if it's a good pain or bad pain, right? And then they unfortunately end up, hurting themselves even more. Another scenario is they ignore pain, not necessarily where they injured themselves, but for example, something common. We have somebody who hurt their knee, but they told us that 6 months ago they actually sprained their ankle, either on the same leg or the opposite leg too. But and when we do our physical assessment, we see that there's a lot of issues on not only the injury side, but on the side that they hurt from previous. So again, all of those come into play when it comes to your body. You don't want to ignore those kind of signs. You definitely want to try to get some help and try to get some advice. Okay. All right, guys. Any questions? So any questions? That was kind of short and sweet there.
So like, how
Yeah.
long did?
Oh, sorry. Go ahead.
How long did you say like the period of recovery was for like ACL injuries and such?
So if you're talking, are you talking about an injury after surgery?
Yeah, after surgery,
Great question. It's typically up to a year.
typically up to a year. And do you think it would go to like its full usability, or are you still restrained?
Great question. Who am I talking to?
You're talking to VJ.
Hi, VJ. So it all depends on the person's prior level of function or prior fitness level and what ultimately their goal is. So, I think let's just take Klay Thompson again, for example. I mean, do you follow basketball at all?
Yeah, I do. Yeah.
So, he hurt himself. He went back. You all know what happened to him recently.
Hmm.
Tore his Achilles, right? So
Yeah.
I don't necessarily think they rushed his rehab per se, but I would say for somebody on his level, it's a double-edged sword, right? They're already pretty high level to begin with, so the recovery should be pretty fast. But at the same time, their level of demand is so much higher than yours and mine, But to answer your question, I would say to return to sport, it's about 8 months to a year. We do have a lot of people who have these kind of ACL injuries around high school, college age, sometimes longer. But if it also depends on their sport. So let's just say for normal function, just to jog and to do some light workouts, I would say about 8 months. But if somebody were to say, hey, I want to get back to, tennis or golf, I would say just to be on the safe side, you want to go longer, just to really test out your body. Great question.
Thank you.
You're welcome.
Hello.
Yeah, I had a question. So like, it's not specifically related to ACL tears, but it's like I heard people say cold temperature makes makes you more prone to injuries. I don't know if that's true or not, but is it because like the cold temperature is restricting your blood flow and that's why, or is it like some
That's a
other
great
reason?
question, Jason. Man, there's a lot of discussion right now in terms of cryotherapy or cold treatment, and then the opposite, which is like, thermal, kind of treatments. It's it's hard to generalize whether cold therapy is good or bad. I will say this. I think when it comes to what cold therapy or cryotherapy is, if that's what we're talking about, what it's for, it's to help with any kind of inflammation that might happen in the body. Okay. So most experts do agree that to combat some sort of inflammation, whether it's acute meaning is like a new kind of inflammation, then there are a lot of people who advocate for some sort of cold therapy. That's why you probably know that there's a lot of cryo chambers popping up right now. There's a lot of the compression therapies popping up right now, because there is some evidence behind that for sure. I think what you were alluding to a little bit was something about like the blood flow or something like that. Is that what you're saying, Jason?
Yeah, it's like if you're exercising in a cold temperature, does that
Mm,
make you more prone to injuries?
okay, so I think in my answer to that would be if you were going to be working out, you do want to make sure you are limber, you do have your mobile. You don't necessarily you probably have a better chance of not hurting yourself if you were to warm up, so to speak. Whether stretching, whether doing some active stretches or dynamic stretches. Um, because you definitely don't want to just start performing and be too stiff or cold. Did I answer your question, Jason?
Yeah. Yeah, and then my second part was like, does that have to do anything with blood flow or no? It's just like,
It does. It does. I think that yes, when it is colder, there is less blood flow happening through the limbs, and then that can create a little bit more. You might be a little bit more prone to injury. Blood means is typically good for you, where you do want to make sure that it's part of the healing, basically. Um, but again, there is some therapeutic effects with cold therapy too, where if it's too inflamed, then you do want to apply that kind of thing. I think if it's injury based off of, or trying to prevent an injury, like let's say before an activity, like what you're just going to go out there and start working out or playing ball or football or something. I think in general, it's better to go out there and just kind of warm up before, just going out there cold.
thank you. Yeah.
You're welcome.
Hello.
Hi, Jack.
Uh, I was going to ask, like, how do you recognize a first time injury? Like, after practices, you might be sore, or something hurts from a knock. Like, how do you defer that from like a knock to an injury? Because this one time, so I tore my quad, and then so it was at a practice. I felt something in there, and then I actually stopped, and the next day I played a game, and then it just completely um tore. So how do I recognize uh whether it's like a serious injury or just a little knock?
Great question, Jack. Okay, so under ideal circumstances, even after that first injury, you would have a professional take a look at your knee, right? Whether it's a physical therapist, a doctor, or even a qualified athletic trainer. But let's say you're not in that situation where somebody can take a look at you, right? Usually there is a 48-hour rule, meaning if after 48 hours it's still hurting, it could be something a little bit more than just a muscle soreness, right? If it's something that resolves on its own with a little bit of self-care, then usually within the first 48 hours, you're good, right? Now, great question. I think, if it's something that, let's say it goes beyond 48 hours, you've kind of done your due diligence and do some stretches, do some warm-ups, try to just resume some of the activities and it still doesn't feel right, then you probably should get some proper, get an assessment done. Swelling is another good one too, where if you have a lot of swelling in the area. Now, I admittedly, it's kind of hard to see sometimes if there's swelling in an area, right? Unless it's an ankle or a joint or an elbow or something. But you can look for signs of swelling. Swelling doesn't go away. I look for signs of bruising. Bruising, again, that doesn't respond over the next 48 hours. I also look for a little bit of sign of loss of range of motion. If you start to notice like, man, I can't straighten it out anymore, I can't bend it, then again, I would look for seek advice from a professional.
Okay,
Good
thank
question,
you.
Jack. Great question.
Bring up range of motion. I was actually going to ask, in a workout, it's like range of motion is obviously over weights, but I don't know why it's that. Like, um, you would suggest range of motion over weights, right?
I
So
think that, so it's a question, what's more important,
yeah,
range of motion or strength, for
yeah,
example? I'm gonna take the easy way out, and you gotta have both, right? I think, especially as more research comes out, the more mobility you have, then typically you're going to have more less injury. But I think it's going to have to come down to having a good balance of both, to be quite honest. So yeah, I hate to take the easy way out, but Jason, but both are equally important. And I think, especially in my line of work, it's a matter of looking at the person in general and figuring out where they're lacking. I'll give you an example. For example, somebody who's a yoga instructor or yoga fan, very limber, as you can probably imagine, right? But they still get injuries because they still have strength issues in some parts more than the other. And then let's say you have somebody who is strong or has a lot of hypertrophy, meaning they're have a lot of muscle mass, they don't have a lot of mobility. They can also be prone to certain kind of injuries too. So it's hard to say whether whether one's more important than the other. I think both of them for sure have to be checked off the box. Those two boxes have to be checked off, so to speak.
okay, thank you.
You're welcome.
Yeah, if you guys have any questions, just ask, just unmute. But yeah, if we don't have, we'll just
I do have a
end it
couple
off.
of other
Oh, okay, never
after
mind.
this. Then, is it okay if I go ahead and go through the last few things,
Yeah,
Jason?
for
Would that
sure.
be okay? All right. So I want to leave with a couple of tips, guys. If you have any more questions later on, either for yourself or your family member or teammate, you can go on our website, empowerptwellness.com /sports injury. We have a whole page dedicated to that. You can go also, guys, you guys can also go on Instagram and follow us on there. Again, we have a bunch of exercises and advice on things sports related and otherwise. I also I wrote a report on our website on how to recover from common sports injuries, not only knee strains, groin injuries, ankle sprains, shin splints. I think, Jason, you mentioned that to me before. I do have some tips on that. I don't mind doing another one of these in the future for the shin splints, but I do have that advice on this particular download. So all you have to do is go on our website and download it, or you can reach out to me directly and ask for that report, and I just need to send it to an email. So there's that, and what we do here at our clinic, because this is something that we do run here often, Jason, is you do offer a sports injury risk assessment. We've always had this, but with everything happening over the last year, I think we can all agree that there's a lot more injuries that will probably happen, unfortunately, because a lot of the athletes are going to be coming back over the next, hopefully, 6 to 8 months. But for you and your group, if you guys are interested in applying for a sports injury risk assessment, all you got to do is let me know. It basically breaks down to two components. You get to work with one of our sports specialists for about half an hour. We perform these objective, specific, validated tests to determine how much of a risk you are in injuring your ACL or your knee. And then after that, we go over some of the treatments that you wouldn't have to do in order to prevent that kind of injury. This is Alex. He's one of our athletes from local athletes. I can say what school, but he's in college for soccer. He injured his ankle and then ended up seeing us for his knee because his uninvolved side was feeling a lot weaker, and a test did show a pretty significant difference. So check this out. His right ankle was what hurt. He sprained it during soccer last season, never quite healed. After we were done treating his right ankle, he said, my left knee has never felt really that good. Our assessment with Michelle here, our sports therapist, revealed a lot of weaknesses on that left side. And quite frankly, that's one of his big concerns with the season moving forward, was he was going to hurt himself. So he's going through some treatment right now, specifically working on his left side deficits, and also keeping an eye on that right ankle too, if you guys can see that. So yeah, for your group, Jason, or anybody else, if you put on your Instagram or website, that offer will be up there. They just have to kind of go on and apply and make sure they're a good fit for that assessment. If you have any other questions, like I said, just reach out to me directly. I'll give Jason my information. You guys can share it amongst your group. If you guys want to message us on Instagram too, you can just mention the sports assessment and we can set that up for you. Or if you have any other questions, just feel free to reach out. I promise I'll get to you faster than I did with Jason. So, and I think that's it, guys. Thanks for having me. I'll leave this up there if you guys want to take a quick picture of it or something, and you guys can reach out and ask me anything about sports or physical therapy or how to inquire about these sports injury assessments. Sounds like some of you guys already need one of these. So I better see you guys at the clinic soon. Yeah.
Where are you located by? Are you in California?
We are in California. Yeah, we're here in Chino Hills, California.
Chino Hills. I see. All right. Thank you. Thank you so much for coming and giving us knowledge about injuries prevention and as well as ACL tears. So yeah, I guess that's the end of the slides, right? So like Dr. Carlo said, if you guys have any questions, email him, follow them on Instagram, and yeah, if you want to do a sports injury risk assessment, reach out and you will definitely get the test. But I think that will conclude our guest speaker event. Thank you so much for coming, and thank you everyone for joining. So yeah, you guys are free to go. I'll see you guys next time.
All right, guys. Thank you.
See ya. Thank you.
Bye.